Yeah, and just full disclosure, Brent and I we both had big old nice 2-pound tomahawk ribeye steaks before we started. So we're doing good with that. We were walking and you were talking about some of the potential mechanisms by which this or other types of dietary interventions may work. Maybe you can discuss a little bit about the gut and how you perceive the gut and why do we think we're having some success with removing what would otherwise be considered healthy foods like fruits and vegetables to some degree. What do you think is going on potentially?
The whole reason I went on it is I think I heard you and another guy and one of my colleagues said, hey, what about this meat diet? And I'm like, are you crazy? And for years I had problems myself with digestive issues, never had a flat stomach, always bloated. And the thing is, I said, anything I'm going to do for my patients, I'm going to try on myself. And so I tried all these other different diets, and really after that 3-4 week adaptation phase, the constipation, diarrhea, everything that people are talking about, it was great. No pain, flat stomach, even being able to tolerate more foods. And one of the things we were talking about, and I see this in literature a lot, is we're starting to question, is more fiber or more prebiotics, more probiotics necessarily a good thing? And I think it was you that maybe pull up a trial not too long ago that said maybe some of this fiber is actually increasing the risk of colon cancer in people. And I think what we're doing as a society where everything's got to have fiber or prebiotics or probiotics is actually making people worse, because we're overfeeding their bacteria, we're overfeeding the weeds. And so many people are getting autoimmune diseases, cardiac, chronic diseases. And we know 80-85% of your immune system's in that gut. So if you're feeling that gut and having that thing blow up, you're going to have disease processes. And I would say most of the patients I see, that it's very rarely that they're not having a digestive upset issue. And most of them are either it's a fungal like candida, or they have something like small intestinal bacterial overgrowth. And it's literally dumping fertilizer on a fire is what I see in those patients.
Yeah, no doubt. I think the gut is a root cause, or the common pathway for most of the chronic disease we see, whether autoimmune disease or even mental health disorders, things like that. So as you mentioned, with being a naturopath, you have many roles, you wear many hats, and you said something about neuroscience. And I'm interested how that sort of the interplay between what you're doing and I guess the mental health side of neuroscience. I guess for people that aren't aware too much about what naturopaths do, what is a purview? What kind of things are you suited up for treating? Is it pretty much all chronic disease, or what kind of things are you sort of mostly focusing on?
I think there's two areas of medicine that I like to tell people that we focus in. One is it's active or reactive healthcare. It's that chronic disease milieu of, I've been to 14, 15 different specialists and I'd never get an answer. Those are the people that we attract a lot. The other is proactive medicine. These are people that are trying to improve their health. And that's different than preventative medicine, where we're doing screenings or doing things to prevent negative things. Proactive is more, I want to live longer. I want to be healthier. I want to have more energy. So most of the patients that we see are usually not getting an answer with that standard equation of, hey, I got this problem, take this. And I would say medicine's starting to shift more and more towards, we call it functional medicine. The problem is, as you've probably seen, is it really hasn't changed that much. We just went from prescribing medication to prescribing the heck out of supplements for symptoms, right? But we're not addressing root cause issues. And I think dietarily is a huge root cause issue. We know when that gut's on fire, so your brain's on fire. And so one of the things that I'm passionate about in Chicago, the neuroscience, we can actually do SPECT scans of people's brains and see that they're lit up. And a lot of that, when we dig deep and we figure out what are some of the causations, it's got to be nutrients and how their digestive system's focused.
Yeah, interesting. And again, part of it's my own ignorance because I don't know a lot about naturopathy, but you think about it as somebody's going to hear some herbs and spices and things like that. But you're talking about SPECT scans, which are obviously very high-end, high-tech type stuff that you have access to. So it's interesting to see that. Now, you'd mentioned that at least in the world of the naturopathic world, there still is this bias towards kind of plant-based. Is that fair to say? And you're obviously going against the grain in that career path.
I would totally agree with you. When we go to school, we're taught eat lots of vegetables, high fiber diet, and even the cafeteria is mostly plant-based. The problem is with that is if you don't know better, I'm going through school, my brain's foggy, you're bloated all the time, you're wondering why your stomach's hurting all the time. And that message is still conveyed out there. And there's a large group of us that still focus on that. The other group, though, there is some of us out there that are now learning and getting educated by people like yourself that, hey, we're doing this wrong. And in medicine, we have that history of always trying to say this is the right way, and then we quickly figure out, oh, this is wrong. And so I think I stand out in that aspect. I also think, like in medicine with any practitioner, we all have our different specialties. I like to say, I do what's best for my patient. It's outcome-based medicine. So I work with conventional and alternative things. I'll prescribe medications if it's required. I'll send a person for surgery. I'll do some pretty high-end testing for a person. Mainly, I just want to get answers for that patient because it's about the outcomes. It's not about the